Winter storms may have delayed deliveries of new coronavirus vaccine doses to several states, but vaccination efforts nationwide are still gaining momentum. Nearly 40 million Americans have received at least one dose. More than 15 million are fully vaccinated. And the Biden administration is once again increasing its weekly vaccine supply. This comes as more states say they need more shots. Cases in the U.S. are nearing 28 million. More than 487,000 lives have been lost. And Dr. Anthony Fauci is urging Americans not to get complacent as the White House warns a recent drop in new infections could be, quote, misleading. Jonathan Vigliotti reports from Los Angeles.
The vaccine rollout remains bumpy, supplies still tight, but help, and lots of it, could be on the way.
We're increasing the vaccine supply to 13.5 million doses per week that will go out to states. This is a 57% increase.
Today, the Biden administration also announcing it will double to 2 million the number of weekly vaccine doses sent to local pharmacies. Last month, Los Angeles was the epicenter of the COVID crisis. Hospitals overwhelmed with 0 available ICU beds.
Pull up your sleeve real quick for me, please.
Today, FEMA opening up its first mega vaccination site.
There is the proverbial light at the end of the tunnel. The good news, parts of the state are already beginning to open back up.
Amid the signs of recovery,
what is encouraging to you and what is discouraging to you?
I'm discouraged by the variants being more readily spread and potentially overcoming our natural immunity and perhaps some vaccine-induced immunity. On the other hand, cases are plummeting.
By week's end, it could be back to the classroom in Los Angeles for the nation's second largest school district, at least K through 6 schools. The American Academy of Pediatrics says more than 3 million children have now tested positive for the virus. While COVID's impact on kids is typically not severe, doctors are seeing a small but disturbing growth in cases of multisystem inflammatory syndrome in children, or MIS-C. It first emerged last spring, and the CDC reports a total of just 2,000 cases and 30 deaths. But at Children's National Hospital in Washington, half the patients there were taken to ICUs. It's now up to 90%.
We're calling it a tsunami wave. It's a bigger wave of MIS-C than we saw in the first wave. 80% of them have no underlying medical condition, so healthy kids.
5-year-old Janiyah Johnson recovered from MIS-C after her condition suddenly deteriorated.
Her liver and her kidneys are not functioning to the levels that they should be. Soon as she got to the hospital, they grabbed her. They started hooking her up to different IVs and different machines. And the doctor told us, if you guys would have possibly waited another day, we can't promise that we would have been able to save her.
And just last week, Dr. Fauci said anyone who wants a vaccine should be able to get one by April. He's now pushing that back to late May. Los Angeles has struggled with their supply, which is why this FEMA-run location is a welcome sight. As many as 6,000 people should be able to get their vaccine every single day. Elaine?
Jonathan Vigliotti, thank you. Dr. Leo Nissola joins me now. He's a physician and immunotherapy scientist. Doctor, welcome. It's good to see you again. The Biden administration is increasing the vaccine supply to 13.5 million doses per week. Some states have been running out of shots. How have you seen the vaccination effort play out on the front lines over the last several weeks?
Thank you for having me. Good to see you again. I think right now we are in the lowest case number in months in this pandemic, which is great news. But again, the vaccine rollout has been bumpy. I think it's challenging for some states to be able to deliver the vaccines to everyone that wants them. But also there is a challenge on making sure that we are addressing those surgical needs that are the vaccination plans for communities that have been hit the hardest by this pandemic. And I think this is something that we're going to be seeing more and more of as the CDC starts to release the data on who is getting those shots. Today, they released a new data set that shows the gender, age, and racial demographics of those who are getting vaccinated. As I mentioned to you in the past, I've been eager to see those numbers. As you know, Blacks represent 12% of the U.S. population, And so far, only 6% of the vaccination. So I'm a little bit worried that we are not making the vaccines available for everyone at the same time.
Yeah, it's a really good point, and one I know that you and I have talked about in the past. When you see these sort of racial disparities, this is important data to actually have as we move forward here. Well, Dr. Fauci now says that it could be late May or early June when vaccines are available to the general public, as he calls, quote, open season. Given that timeline, when could we see a major improvement in the numbers, and when should people expect to see some sense of normalcy?
That's right. And again, I wish we really gotten to a point where we can call out just the habit of we don't actually know exactly when some of these things will actually happen. So Dr. Fauci has been saying for months that we are still a long ways from the end of this pandemic, and he's right. Now, the vaccine timelines change, and we move the goalposts as new data comes in. First, on the 22nd, we're gonna see on the 26th, we're gonna see J&J's emergency use authorization hearing, and then we are gonna follow up and see if they're going to grant the emergency use for that vaccine. And should that happen, which we are all assuming it will, we are still needing to make sure that we have enough supply. J&J said that they are going to make 10 million doses of this vaccine available in the next couple of months, but still, we have 330 million Americans to vaccinate. So I do think that entering another player in the market, we are going to be able to vaccinate more people and get those shots into arms sooner than the end of the year. But still, I do agree that for the vaccines to be widely available for everyone who wants them, it seems more likely towards June, July than May, April to me.
Well, there has been a recent decline in COVID cases, but the White House says that this drop could be misleading. Dr. Nissola, what is the biggest threat right now?
I think the biggest threat right now is new infections. I've been saying this for a while now, and I think it's very important for folks to understand. As long as we have new infections, we're prone to new variants, new mutations. As you've seen, we have our homegrown mutations now on the merge of the hybrid of a couple of mutations that made their way into the United States. So I think as we get tired of this pandemic, as we are all experiencing collectively a pandemic fatigue, it's also important for us to understand that it stops with you. It stops with you not getting infection. It stops with you not allowing yourself to be exposed to the virus if you can. Of course, if you can't prevent yourself from being exposed to others, like we're seeing our essential workers exposing themselves to this virus to keep us all serviced through the course of this pandemic. And I want to make sure that we are also addressing their access to the vaccines.
And finally, Doctor, more than 3 million children in the U.S. have tested positive for the coronavirus since the start of the pandemic. The American Academy of Pediatrics says nearly 100,000 of those cases were identified in early February. How concerning is this as the debate to open schools continues?
It's really concerning, and researchers and scientists and doctors are looking into this data to understand what the actual implication of reopening schools will have. My position is pretty clear. I'm a strong advocate for essential workers to be vaccinated first. They have, and they are doing it right now as we speak, protecting us by doing the job in person that allows our society to function. And I think if we want to reopen schools, my biggest concern is with the health of our teachers. And I want to make sure that our teachers are immunized before we ask them to go back to in-person learning. I think this is a tremendous challenge for parents and for decision makers. But I don't understand how teachers would not be considered essential workers. Their work is essential.
Yeah, I think a lot of people would agree with you, Dr. Leo Nissola. Doctor, always great to have you and have your insight. Thank you very much.
Thanks for having me.